Okay, so good morning, everyone, and welcome to today's show with EMS. And today we're not alone for this breakfast show. We'll be joined in with Dr. Prithvi, the Managing Director of MIOT International Hospital. So good morning, Doctor. How are you?
I'm very well, thank you. Good morning.
And we also have Miss Lisa Chetty as well from MIOT International. So how are you feeling this morning?
Fine, thank you.
All right. So today we're going to learn a little bit more about MIOT International and what it is doing and what's happening, what we'll have in future, especially in Seychelles, in regards to MIOT International Hospital. So, Doctor, MIOT is actually one of India's best hospital. That's what I read. So,
Sure.
yeah, and it has attracted from around 130 countries, right? Patients from around 130 countries.
Sure.
And Seychelles is one of them.
Yeah.
So talk to us a little bit about MIOT, please.
So MIOT was started 25 years ago, and the goal to start MIOT was to try to provide cutting-edge, sophisticated, complex disease cure within India for Indians so that they would not have to venture overseas. That was the goal with starting MIOT 25 years ago.
So you studied the healthcare landscape of Seychelles. What's your conclusion in regards to it at the time?
So our partnership with the Ministry of Health Seychelles goes back almost 2 decades. There is, unfortunately, a lot of non-communicable disease load in Seychelles. So there's a lot of work to be done. And obviously, for a healthcare provider, it's a fascinating space in terms of dealing with the various patients.
And is there any big attraction when it comes to MIOT right here in Seychelles?
Well, I think the fact that we have treated so many hundreds of thousands of Seychellois back home in India, traveling all the way from Seychelles, we are uniquely placed to understand what are the critical disease areas that can be sorted out within the country. And our attempt is to try our best to do so, to reduce the burden on the patient and their families from traveling overseas for care.
OK. Et bien sûr, pour la bon matin aussi, nous pouvons faire une interview aussi en créole. Côté, nous pouvons Miss Lisa Chetty. Miss Lisa, moi, je suis content ou cause avec moi, bien sûr, un petit peu le côté eye care, you know, MIOT Hospital here in Seychelles, mais eye care, right?
Yes.
Donne-moi un petit peu l'explication là, bien sûr, le côté ça eye care.
iCare, tu commencé avec un partnership entre Visas Optical, qui moi m'ont set up from 2016. Et pour même raison, moi t'en ai mon bon patient qui m'a typé refer. Et moi t'ai senti qui, pour moi, capable follow up les autres progrès. Nous besoin faire quelque chose qui nous dit pour faire plus, qui aussi tant c'est loi qui nous capable quitter ces ou faire autres traitements à cause d'autres récupération et tout, et basé aussi sur autres mental health. So, nous faisons un partnership avec MIOT International et plus quelque chose que nous sommes capables de faire pour autres, pour qu'ils autres ici, pour bénéficier de ces lois, then nous pouvons faire. En ce moment, nous, Total Eye Care, nous pouvons faire cataract surgery, certain glaucoma surgery, pterygium, et de plus en plus, nous pouvons faire plus qualité procédure avec les billes, c'est qui ces lois ici, qui aident autres avec d'autres récupérations.
OK, Monsieur T, on cause un petit peu le côté surgery and so on. Bien sûr, pour les gens qui ne connaissent pas vraiment, moi commence à entendre, moi pas connais les autres faire surgery. Là on peut cause de surgery, est-ce qu'il y a une surgery qui ou stay over as well, ou soit quelque chose qu'on vient faire après ou à le côté?
En ce moment, nous avons un day procedure center qui veut dire nous pouvons ouvrir seulement during the day. Nous pas peut faire aucun overnight stay. Peut-être dans les futurs, mais c'est moi, ou venir bon matin, nous prenons soin de nous faisons surgery. Dès que nous sentons, ou fait ou pareil, nous laissons al côté.
Et Monsieur T, lundi, mon il vient cause autres exactement. Est-ce qu'ils autres continuent à faire ça suivi cause autres même, ou soit, ou parle dans l'hôpital, comme si un petit peu, ça coûte?
Non, nous suivi et avec nous-mêmes. Oui, si arrive une situation qui nous sentit un patient développe une complication qui vraiment en dehors nous contrôle et il pour besoin, pareil nous dit multi-speciality care, then we nous refer avec MIOT International Chennai à cause après tout c'est nos patients qui avant tout.
Okay.
Nous pour faire tout que la santé de nos patients, récupération de nos patients est optimale. So, nous faisons sa décision basée sur ce qui nous voit avec nos patients.
Et depuis les autres nouvelles, ça eye care, bien si, ça eye care facility, jusqu'à là, qui m'a yon ou quelque chose y aller. Correct comme si n'a pas aucun.
Quelque chose peut dérouler bien, nous développons tous nos protocoles, nous mettons en place, nos teams, nous on a une quantité de teamwork, nous travaillons bien ensemble, et nos goals, c'est oui, nous continuons à travailler ensemble et nous mettons vision la santé de nos patients avant.
Okay. So, doctor, back to you.
Yeah.
Let's talk a bit about MIOT International once again, right here in Seychelles.
Right.
So, shall we talk about the future, or what do you plan on having right here in Seychelles? Because for now, what we know is in regards to the eye care facility.
Yeah.
Is there anything else that you guys will be coming up with? Is there anything, any specialist, any surgery, anything in regards to MIOT International Hospital?
Well, I think that there is a realization internationally that all health systems the world over are basically purely run and largely dependent on manpower from overseas. If you look at the United States, if you look at the United Kingdom and developed countries like Australia, there's a huge staffing issue that they have in terms of doctors, nurses, etc., etc. And if you look at the demographics in these countries, all the way from ICU care to general ward nursing to top consultant-led care, India has been in the forefront of providing talent in these countries. If you take South India, the southern 4 states, they produce around 75% of the medical workforce of India and also a huge workforce that travels overseas. It is our fervent desire that this great talent that can be tapped at great quality, providing reasonably priced healthcare, as they do in other countries, should also be applicable to Seychelles. Seychelles as a country has a huge problem with the cost of healthcare. The clientele in Seychelles are price sensitive, and being a small country, your GDP spend on healthcare may not be possible to cover cutting edge, serious disease or complex disease type healthcare. With such a small population, both talent and technology are at a premium. It is therefore to the advantage of Seychelles that the introduction of a healthcare giant like India that is capable of producing quality talent as well as handling complex disease is partnered with. And for this, I think the climate to permit this talent transfer and retain this talent transfer should be looked at without prejudice. In the past, the world has always looked at the Caucasians to take the lead in providing high-quality healthcare. But if you look at the world now, if you look at Google, if you look at Microsoft, if you look at Twitter, if you look at any top industry in the world, including NASA, you will see that South Asians and East Asians are taking the lead. So I think it is to the advantage of both entities, India and the Seychelles, that we cooperate very closely, especially in the sphere of healthcare.
Okay, so when you're talking about the healthcare itself,
Yeah.
so that means it's 100% yes, that you're planning to develop more of healthcare, more like we're talking about surgeries and everything like I just said. So this is going to be the future of MIOT International Hospital right here in Seychelles, yeah?
MIOT International Hospital has a huge responsibility in providing healthcare in regions where it is required. We're not interested in reinventing the wheel, and we have great appetite for providing essential services that don't exist on ground in various geographies, not restricted to Seychelles. It depends on the appetite of Seychelles to devour the offering. If you permit us, we're happy to provide whatever you want. But there is a huge issue regarding the possibility of putting these on the ground. There are certain delays, there are certain obstacles, and we are in discussions to make sure that there is no lack of belief that we are totally committed to providing quality healthcare. We are an organization that cuts no corners. We are an organization that is genuine. We are not in any scale of anyone's imagination in the business for a fast buck. And I think our 2-decade relationship with this country has shown that we, compared to other players in this sector, are an organization with a heart.
Very good. Okay, doctor, one more thing in regards to the hospital itself. You're based at Espace.
Yes,
Right.
Espace building.
So, like you said, there has to be an appetite. But if there is, in different sections, I can say, if I can put it this way, will there be any chance of, as you know, here in Seychelles, we've got a percentage of people living with cancer. So they have to travel to India and so on. We've got a percentage of people living with problems with bones and spine, So do you think if there's an appetite for this range of problems, is there a possibility that you can have a hospital right here in Seychelles? Instead of us going to India, you guys can come and do the surgeries and whatsoever here in Seychelles. Do you think that would be possible?
India, especially our organization, has always been in fast-forward mode. My own father, who was a professor of orthopedics and a pioneer in internal fixation and joint replacement surgery, left the government because he felt that the Indian government was too slow. And he set up his organization, MIOT Hospitals, to provide patients with a pace of technology and expertise that the government was unable to provide. However, the Indian government political climate permitted this. The rules of engagement in our bureaucracy permitted this.
Okay.
We hope and we believe that the same will happen here, because I am ready to provide the manpower and the technology yesterday. And once it can be facilitated, we will move like grease lightning.
But let me also add something to this. There is so much that can be done in Seychelles. Okay? We have the manpower from India. We have so many things. But I think there are so many people in key places that take decisions that they have to be aware, okay, of what the intentions are. There are so many barriers to entry in Seychelles when you want to provide something, that the cost it takes in the end for you to provide, you thinking it's X, it becomes X squared. Because the nitty-gritty that you shouldn't have been spending time on, they make you spend time on. I'll give you a simple example. You want to create a hospital, 3 stories. They ask you such a simple thing as 3 pantries, 1 on each floor. Why do you need 3 pantries? You know, when we work privately, we don't work in the same mode that the public sector work. We don't all take lunch at 12. If we have 40 employees, we all gathering in the pantry, at 12 o'clock, and the business doesn't work, and then we all go off at 1. No. We take our lunch when we have the free time. And we are aware that we have to make the patient experience smooth. So if it happens that there are so many times when we first opened in Espace building, I didn't take lunch for a whole day because, my staff they were so busy, and I decided I have to step in to help them. So I didn't take lunch. And the way it works, we start taking lunch from 11:30. It can be until 3:30. So why do you need a pantry on each floor when that space for a pantry on the second and third floor could have been used for something else which would benefit the Seychellois people? So these are the little things that makes no sense. And, you know, when you have somebody who's running a huge hospital, 1,000-bed international hospital, #1 in India, you're dictating these terms to somebody who has built a hospital from scratch.
So basically, we can say that we all want the same thing: best healthcare right here in Seychelles. You want to give the best,
but it goes far beyond this. When you think the barriers to entry, the ease of doing business is so hard that we make Seychelles go backwards. Because if I was, you know, a small entity, I wanted to set up a business, I don't have the money to pay rent for 6 months before I can start my business. It's the same. It goes for when we were setting up our ENT. You know, you want to start ordering your medication, okay? So a provisional license should be given that your medication gets in the country, and once you open your business, you have your medication ready. But no. We ordered our medication, it got stuck at customs for like 3 months. We had to pay rent on that, and we had to pay for the expired medications before it could be released to us. So much money which could be used to benefit the patients is not used to benefit the patients. Is used for other things that should not be happening, should be making the ease of business better.
Okay, so you mentioned ENT. So we're talking about, if I get this right, it's the ear, nose, and throat.
Very good.
Right?
Yeah.
Okay. So you've got an ENT specialist right here. He's there.
Yeah.
Talk a little bit about this, please.
Well, I think what happened was after we decided that we were going to do an exclusive special area and start with eye care, we wanted the area to be similar to our ethos when we started MIOT in India. We wanted a lot of space. We didn't want it to be dirty. We didn't want it to be sort of have an aura that would drive away or make a patient scared. So no hospital smell, no feeling that I'm trapped, and very good aesthetics. So after starting eye care and doing for the last 15 years free camps every month, we found that one of the big disease loads here is upper respiratory issues, which are principally ear, nose, and throat related. And so to address this and therefore reduce the burden on the government sector, as well as reduce the numbers who need to go overseas, we decided to do ENT. ENT and ophthalmology procedures are largely daycare all over the world. You don't need to stay overnight for these, and the technology has now improved to such a remarkable extent that diagnosis can be done with fantastic imaging via fiber optics. And once the children or adults or the elderly know what is wrong with them, that is half the battle won. Because a lot of the time your worry is that you don't know what's going on in your body. So there are beautiful little dinky cameras that can go into a child, that can go seamlessly into a aged person who has very sensitive passages in their nose or in their ears and throat, and diagnose very simple conditions like sinus issues or septal, that is the nasal cartilage issues, right up to dramatic scenarios like cancers.
Okay. So apart from ENT, is there any other specialty? Yeah.
So yes, so we have a digital X-ray unit, and I was on air before to tell the people via your channel that the X-ray was only 200 Seychellois rupees an X-ray, and that you get a report by a senior radiologist within 10 minutes, and the X-rays are given to the patient on a USB stick, and the quality is just out of this world. You see, the thing about providing low-cost, cutting-edge healthcare is about energizing your workforce so that the patient gets the maximum. If you start thinking that the military or the health workforce, both of which are essential services, should be working on a full stomach and lots of sleep, then you've lost the battle. Our professions are a calling. The military is there to defend the country, the health care professionals there to cure disease. That is a calling and not a job. And when you are in a calling, then your goal is number one. Everything else is secondary. We are trained for this. In training, you're taught how to function at a top level on just enough sleep and just enough food. During training, you're trained to function with very little recreation. So we are chosen via tough exams, via tough years of training spent so that we give you the best and you don't have to pay through your nose. So it's not a trade-off. It's a calling.
Doctor, one more thing. You've spoken about the X-ray. Can anyone come in and do the
yeah,
X-ray?
yeah.
Or you have to put an appointment in case anyone wants to have an X-ray?
It works smoother when an appointment is booked.
Okay.
But however, we do have slots for patients who need to walk in. It's an emergency. Something is urgent. Yes, we do cater for this as well, both in the X-ray department and eye care. We cater for this.
Ok. Marie Chetty nous parle en créole là. Ok. Un petit peu le côté eye care, zot ban l'équipement qui peut servir ou capable donner nous un petit peu comme si approfondir nous le sa côté.
Nous l'équipement commence par one a des optometry practice, so one a pour tester les yeux pour donner lunettes, one a pour qui bon diagnostic equipment. Non, bon l'équipement sophistiqué qui aide nous, qui permet nous faire bon suivi, il peut store data, il peut compare data, il peut faire bon trend analysis, qui peut montrer nous, tu viens 6 mois passé, on vient là 6 mois après, il peut build un trend line pour montrer nous si on a un changement dans les yeux. So, non, l'équipement qui varie il aide nous pour détecter glaucoma, il peut aider nous pour voir bon du monde qui a diabète à cause nous burden of diabète est vraiment haut ici, diabète dans les yeux. Mais il extend aussi dans nos operating theater, nous l'équipement pour l'opération cataracte. In fact, nos operating theater, il equipped avec tout quelque chose. Un monde peut arriver, si on a une emergency, un monde, il gagne un heart attack, nous capables revive, un défibrillateur, tout quelque chose. Yeah.
All right, okay.
Et sorry, on top of ça, si l'information est bien, nous, c'est l'operating theater avec la mineure flow, c'est celle. So, qui nous laissons là, et presque tous les 3 seconds, il peut sans là une quantité de fois. So, yeah, we are the only operating theater with laminar airflow ici.
Et Marie Chetty, un petit peu, vous aussi vendez lunettes, right?
Yes.
Est-ce qu'il y a des gens qui ne viennent faire test code autres, et c'est capable de mettre son prescription pour gagner lunettes code?
Yes. Seulement, ok, dans une prescription lunette, il y en a plusieurs quelque chose. Ok, on a sa power. Ok, on a sa qualité lunette qui peut servir, whether it's single vision, multifocal, bifocal. Ok, on a son loupe qui peut servir. Les édimoni fait lunette contre nous. Ok, un exemple, il arrive un problème avec son lunette qui un dit monde qui a diabète son il pas dit nous y a diabète nous pas connaît son prescription sans un exemple. OK, nous pourrions tester son lisier, nous pourrions faire son lunette. OK? Les un dit monde pas faire lunette que nous oui, n'a pas problème nous pour faire son lunette. Mais parfois s'il arrive un problème qui son prescription, il y a un faute là qui capable d'arriver à cause prescription est basée sur subjective, ça qui dit mon peut rapporter ko. Then il vient un petit peu difficile à cause nous besoin de si grand problème avec son lunette, either nous besoin retester, OK, il pour besoin repayer l'autre test, OK, ou il besoin retourner au salon droit qui n'a fait sa lunette à cause nous gagne prescription qui nous travaille là.
Alright.
However, tout un dit mon vient avec une prescription, oui, nous n'a pas aucun problème nous poursuivre son prescription. Là, in testé avec nous, l'exemple sont subjective refraction qui dit nous, il en a un faute là-dedans. OK, nous pour prendre responsabilité pour nous rechecker, pour nous réarranger son lunette. OK, qui ça, il vient là nous.
OK.
OK,
Alright.
ça. Mais seulement, oui, nous optical shop est ouvert pour tout le monde. Nous on a sunglass, nous on a designer frames, on a frames qui pas designer, on appelle les house brand, et nous on a une variété of lenses qui nous servent, et nous aussi on a lens qui nous stockent pour faire les lunettes de suite.
Alright. Miss Chetty, bien si les temps pas nous faveur, un dernier mot que tu as partagé, bien si basé le MIOT International, qui soit le eye care, soit le différents départements, mon cas.
OK. Ça advice que moi pour donner Seychellois, c'est que les il tombe contre nous la santé, OK? Nous pas n'a pas un bargain, un discount. OK? We invest in our health. Et pareil, moi sorti travail, moi fatigué, OK? Moi mettre mon sac à terre, moi mettre mon lens, moi tailler, quand même moi fatigué. Moi faire mon 4 à 5 km, OK? Moi peut invest de la santé. Et pareil, là y arrive côté lisier, côté health, OK? Mon pas comprend à cause y a une mentalité nous peut de côté plus bon marché. OK? À cause bon marché coûte ça après. Pareil, là, moi, tu peux run visas optical, jamais moi, tu fais free sight test. À cause moi, pas tu fais free sight test, à cause moi, pas quoi dans free sight test. Mon quoi qu'il est, un dit mon vient contre moi, il paye un fee, OK? This is my professional fee, et moi donne un comprehensive sight test. Mon bon client, mon bon patient, tu compte bien qui, zot pas qu'à gagner la réponse elsewhere, zot peut venir contre moi, oui, zot pour payer, mais zot pour sortir avec la réponse. Il pareil. MIOT, il a pour ça. OK? Oui, n'a pas rien qui free de MIOT. À cause, nous, bon docteurs, nous try to source the best doctors, OK? The best staff, pour bénéficier ces lois. OK? So, nous pas capable de faire les free, à cause nous besoin de payer sa bonne monde. To get the best, you have to pay.
Okay, Doctor, any last words for our audience out there in regards to MIOT International Hospital, especially right here in Seychelles?
Well, I think it's an exciting time for us in Seychelles because we have a huge appetite in this region. And it's a great place. It's a very safe place. It's such a beautiful place. And our staff love being here, love working here. And we're definitely committed to trying to provide all the things that you said, whether the patient has got chest pain, whether the patient has got problems with their bones, or patient has got cancer. Our goal is to try our very best to ensure that virtually no Seychellois has to leave Seychelles for A to Z treatment.
All right, Doctor. Thank you very much.
Thank you.
It was a pleasure having you here.
Thank you very much.
So, oui, pareillement dit, Plimonnet, ça c'était bien si Dr. Prithvi, et nous aussi nous tenons Miss Lisa Chetty avec nous, bien si on entend bien le côté bonnes affaires, ou lisier, etc. Alors, ça nous a bien fait comprendre pour dire pourquoi pas, pour que tu as testé au lisier, pour que tu as fait un test X-ray, tout ça là, ou qu'à Alcott MIOT International, et on va bien si, gagner un test, tout quelque chose avant en ordre, ça qui est plus important, c'est rester en bonne santé. Thank you very much.
Thank you.
Thank you.